How would you briefly describe your project to someone who is unfamiliar with what you do?
It's a randomized control trial examining mental health outcomes of racially and ethnically diverse older adults at the poverty level with chronic health conditions. We have 2 treatment conditions and 1 control condition. And so we baseline older adults and then score the measures and then stratify and randomly assign them to one of these 3 treatment conditions. And then we collect data after the baseline every 2 weeks. And then at a follow-up for a total of 6 measurement occasions, and we conduct growth modeling on that, a growth modeling analysis, a longitudinal growth modeling analysis. So we also have more than 9,000 audio files of treatment. So that's really exciting to actually see the treatment being given and what's happening. And preliminary results of the clinical trial have revealed reduced depression at fairly high effect sizes, especially for one of the treatment conditions. We have reduced social isolation, reduced suicide desire, and increased social needs being met. The project is called Be With, which stands for belongingness and empathy with intentional targeted helping. So we're equipping big-hearted volunteers and caregivers and aging network providers to be with older adults at a time they might need it the most.
What is something that has surprised you about this project?
Sure. With 600 older adults in our project receiving an 8-week treatment, we have to train about 60 care providers. Well, we actually have, I think, 59 right now. We might be getting up to the 60 was our target. So we have to train these 60 care providers. We train them in a 16-hour training or just 2 trainings or a 2-hour training. And those 2 are assist and B, or just the B training by itself. And what surprised us the most is that after the 8 weeks of treatment have been completed, the care providers that we trained have asked us to keep connecting with their older adults. So despite the trial, that component being completed, we do it in waves. We don't run all 600 through the program at the same time. But when their part of their treatment is complete, they want to continue connecting with their older adults because they've learned so much from them. So our goal was to foster reciprocal relationships, so relationships in which the older adult is benefiting, but also the care provider is benefiting. So older adults have a lot of wisdom, life experience, meaning to share, and we didn't envision people would want to keep doing this for free after the program is over, but it's really been touching us that that's been the case. I guess another thing that surprises me is that some of the counties, their volunteers that we trained, they, oh my gosh, it was amazing. Their volunteers ended up canceling their shifts less, getting somebody to cover their shift, so their volunteer behavior changed. And that was just amazing because we didn't imagine that it would happen. So we got all this feedback that this is exactly why we were volunteering. So while we're not studying burnout specifically, that was another piece that kind of surprised us, that like it helps volunteers better actuate why they're volunteering and keep them in as volunteers and be able to their volunteer behavior changed in terms of like, I feel like what I'm doing matters so much, I'm not going to cancel, or I'm going to get a replacement if I have to. And so it helped some of our counties that reported to me in ways that we just didn't envision. So we know we're doing something that matters and that it's helpful to people on both the provider side as well as the recipient side. They get so much out of it. Like they report like I feel like I got more out of it than my older adult. Like I feel like I benefited more, and the trainings are transformative. I mean, people report that they're better spouses, that they didn't realize that they needed to check in with their kid, I had one senior center director who noticed invitations in her brother and he had lost weight and had posted a picture on Facebook. And she's given me permission to share this story at any point in time. But her brother had a fully formed suicide plan, and she did an intervention with her brother. So it's pouring into volunteers in a way that I didn't realize. It's like, we're giving you, equipping you to do this. And so I think sometimes volunteers visit the home, they see the meals piling up, notice the older adults voluntarily stopping of eating and drinking, don't know what to do.
Mhm.
That's when you get burned out. But if you can actually help someone, we know the research shows that if you help someone else, they actually also, that also helps us. That helps the person that is the helper. And so I just think it's we're really blessed that ACL funded us, and that we've gotten to do this. It's been some of the most meaningful work of our life.
How will your project remain sustainable?
Sure. Our trial was intended to measure the effectiveness of these trainings, because there's no suicide intervention training, social isolation training on the National Council on Aging's evidence-based registry. So part of the beginning of sustainability is to garner that evidence to get assist in the B training on the National Council on Aging's evidence-based registry, which would unlock Title 3D funds to equip AAAs and counties across the country to be able to get suicide intervention training, social isolation training into their networks. And so that's the first part. We've also been working with the North Carolina Department of Aging, who amazingly gathered 90 aging leaders to be trained in Assist and B. And those aging leaders, we were able to study them separate from our clinical trial and learn what is needed in order to implement this, because we know the aging network is very diverse and different in different areas. And so they collected these leaders from across their entire state, and we were able to collect data. So I'm afraid I couldn't summarize in a quick interview all of what's needed for implementation sustainability, but we have a really good idea of next steps. So we're really hoping that this work continues to be supported financially, and that we were able to kind of start that work for implementation in the future.
How have partnerships affected your project?
One thing that was a little bit of a hiccup at the beginning, but was actually amazing to learn, is that the counties didn't want us to share contact information or phone numbers of older adults with the people we were training. So I was like, gosh, we are opening basically a virtual therapy clinic, and for 600 older adults. And how are we going to do this if we don't share the phone numbers with the people we're training? So we actually partnered with software engineers. So one of our partners is called Friendly Buzz. And these software engineers actually built us a system in which calling partners can log into the system. And so they dial a phone number, and then we program their caseload, their older adults, into their phone number on the backside of Friendly Buzz. And then the calling partner pushes 1 for Mary, 2 for John, and they never get the phone number. So we're able to kind of uphold some confidentiality and protective measures that the counties want, but we're also able to automatically audio record every single treatment dose that takes place. And after cleaning them, we have over 20,000, but after cleaning them, there's going to be about 9,000 likely that are able to be accessed. And our goal was, I think, 3,840. So the treatment is amazing. And we have started a coding process to be able to, so working as I'm a faculty at a university, we have access to all kinds of things like REDCap and Qualtrics and all kinds of different supports for conducting rigorous research. So I think this is actually going to be a really big benefit for the Aging Network, because other entities may want to conduct research with older adults, or there may be warm calling therapeutic services that counties want to operate. And we've found a solution for protecting those older adult contact information through this company called Friendly Buzz.
What do you wish you would have known prior to beginning the project?
To be honest, like, this is a lot of work, and it's also very impactful. And I've been doing work in this space for a long time, but there's a level of impact that's just really touching, as well as just the amount of effort it requires. So I knew it would be a lot of work, where we train people, we supervise the people that we train, we meet with them weekly, we track their calls. We also keep really organized records through share files. So members of my research lab are able to look at those share files every day and determine which older adults need to be measured that day. And we're keeping the measurement, of course, separate from the treatment. So our graduate students in the Hope Lab at Georgia State and at Virginia Tech, they, as far as like, what do I wish I would have known prior? I wish I would have known it was a lot of work, more work than I thought, but also that some of the challenges our graduate students have actually been able to solve. So some of our students like Sebastian, Hannah, Jordan, Andrea, Brittany, like these students have come up with really innovative solutions, whether it was ways to communicate with each other, setting up a Google Voice number, GroupMe, and communicating daily, what are the goals today, to our shared GroupMe. Our lab is really efficient, and there's a lot of big-hearted students in our lab that have made us just a lot more successful.
Tell me something fun, unique, or interesting about yourself.
As far as interesting, this summer I was honored to actually travel to Australia and gave a keynote on the preliminary results. So I was surprised. We're not done with the trial, but the this wasn't something I applied for, but the International Association for Suicide Prevention had asked for a keynote of these preliminary results. And I was a little nervous, like, the results aren't finished yet. And it was just incredible. The response to this clinical trial in the beginning, evidence was incredibly well received by a global audience. So I got to meet with the World Health Organization, faculty from many different countries who are interested in kind of how do we combat social isolation, the continuum of social isolation to suicide across populations. And they really felt like this was innovative. I mean, it's everywhere from equipping home delivered meal providers to do these suicide interventions, to big-hearted volunteers, to actually aging network staff. And so how do we find those touch points and equip them with the evidence-based skills they need to be able to be who they need to be for older adults at a time that it matters most.